Welcome to A1 Materials. Today's video is all about the main arterial stem of the upper limb structures. That is the axillary artery. That is the major and arterial stem that give strong perfusion to the rest of the upper limb through their continuous branches, right? Now watch. The first thing first about this video is to introduce the structure that we are appreciating, right? So we have the introduction. What is axillary artery? Axillary artery is the main artery of the upper limb, which arises from the outer border of the first rib as a downward continuation of the subclavian artery. It is this artery that gives rise to other arteries that supplies to upper limb structures, giving them strong perfusion, right? At the level of the inferior border or the lower border of the tres major muscle, this artery terminates by giving a continuation called the brachial artery. At the level of the neck of the radius, the brachial artery bifurcates into two terminal branches, the radial and the ulnar artery. The radial and ulnar artery form the superficial and deep palmar arches that give perfusion to the hand. That is how those structures are wired, supplying to the upper limb structures, right? So the axillary artery is the main artery of the upper limb, which arises from the outer border of the first rib as a downward continuation of the subclavian artery. Now watch, this is our first rib, right? So here is first rib. This is first rib, right? In here is the inner border of the first rib. Still remains the subclavian artery. So this is the inner border of the first rib. The inner border of the first rib still remains the subclavian artery. This is a subclavian artery. While from the outer border here goes downward is the axillary artery. That means the outer border of the first rib is an important landmark because it denotes or indicates the termination of the subclavian artery and the origin of the axillary artery. Here is the outer border of the first rib. This is the axillary artery goes downward. Right? So that is how they are being fashioned at the level of the ribs, right? Because the inner border of the first rib remains the subclavian artery, while the outer border is the landmark because it indicates the termination of the subclavian artery where it terminates, and also indicate the origin of the axillary artery. So the next outline here is the origin. Where does the axillary artery originate? That is the origin. Where does it originate, right? It originates at the level of the outer border of the first rib. That is the origin, right? Let's talk about the next outline, which is the cause. This is a standard outline in writing axillary artery in medical board exam. It is the standard outline, standard anatomy outline in presenting axillary artery in medical board exam. Our A1 materials is perfect and highly approved. Now watch. The cause simply means how does the axillary artery runs in the axilla? How does it courses through the axilla, right? That is what the cause simply means. Now what? The axillary artery originates from the outer border of the first rib as a downward continuation of the subclavian artery at the level of the outer border of the first rib. As it courses through the axilla, from the apex of the axilla to the base, along the lateral wall, nearer to the anterior wall than the posterior wall. That means it courses along the lateral wall, nearer to the anterior wall than the posterior wall, from the apex of the axilla to its what? Base, right? As it courses along this axilla, it is being crossed superficially by the pectoralis minor muscle to divide it into 3 parts. The pectoralis minor muscle divides the axillary artery into 3 parts by crossing it superficially. This is the pectoralis minor muscle. It crosses superficially to the axillary artery and divides it into 3 parts. The first part, the second part, and the third part. The first part has a single branch. The second part has a double branch. The third part has 3 branches. So, the first part, the second part, and third part. The first part can be called the superior part. The second part can be called the posterior part. The third part can be called the distal, the inferior part. So, you can see now that, recall that this division is in relation to the position of the pectoralis minor muscle, right? The first part can be called the superior part, and here is it, right? The first branch. And we have a mnemonic to remember the 6 branches of the axillary artery, because axillary artery has 6 branches, which is being divided by the pectoralis minor muscle, right? The first part has first branch, which is this, which is the superior part, that is proximal to the pectoralis minor muscle. While the second part has 2 branches, which is deep to the pectoralis minor muscle. The third part is the inferior part, below part, which is what? Distal, away from the pectoralis minor muscle. That is to say that the first part of the axillary artery is proximal, closer to the pectoralis minor muscle, while the second part is deep. You can see that this one is deep. It's deep, like it lies at the back. It is deep to the pectoralis minor muscle, while the third part is away, distal. It is away, distal. Something distal means away from a structure, while proximal means closer. That means the first part is closer to the pectoralis minor muscle, while the third part is distal. It is distal, away. That is why it's inferior, it's below. It's distal, away from the pectoralis minor muscle, right? So, the mnemonic to remember the branches of the axillary artery as we proceed. Thoracopass. This is first part. This is second part. This is third part, right? Now watch. We have 1 branch in the first part, 2 branches in the second part, and 3 branches in the third part, making it 6 branches of the axillary artery. The first branch here is called the superior thoracic artery, SU, superior thoracic artery. Look at it here. The superior thoracic artery. The superior thoracic artery is actually the smallest branch of the axillary artery. It's the smallest branch of the axillary artery, which arises or which runs along the clavus, the subclavius. It arises near the subclavius muscle and passes between the pectoralis minor muscle and the pectoralis major muscle, where it supplies to those muscles and also supplies to the medial wall of the axilla. You have to understand that the branches of the axillary artery actually supplies to the walls of the axilla and also some important structures in the upper limb and the pectoral region. That is what it does, right? So the superior thoracic artery is the smallest branch of the axillary artery, which arises near the subclavius muscle, passing between the pectoralis minor muscle and the pectoralis major muscle, and supplies to this muscle and also supply or give a strong perfusion to the medial wall of the axilla, right? So that is all about the first part. You can see the mnemonic SU means superior thoracic artery or supreme thoracic artery. It can be called the supreme thoracic artery, right? So the next branch we shall be discussing is the branch from the second part, where we have the thoracoacromial artery or the acromiothoracic artery. Thoracoacromia or acromiothoracic artery. This is the branch that is arising from the second part of the axillary artery. This thoracoacromial artery emerges along the upper border of the pectoralis minor muscle, where it pierces the clavipectoral fascia and bifurcates into 4 branches. The thoracoacromial artery emerges along the upper border of the pectoralis minor muscle. You can see it here at the upper border, where it pierces the clavipectoral fascia to bifurcate into 4 branches. The first branch, second, third, and fourth. Those branches include the pectoral branch, the acromial branch, the clavicular branch, and deltoid branch. These are the branches of the thoracoacromial artery or the acromiothoracic artery. These 4 branches radiate right angle within themselves. You can see they radiate right angle within themselves, or they radiate an angle within themselves. The pectoral branch supplies the pectoral region. The acromial branch ends by joining with the anastomosis over the acromion process of the scapula. The clavicular branch supplies to the sternoclavicular joint, while the deltoid branch supplies to the deltoid muscle and other structures around that region. That is how the thoracoacromial artery or the acromiothoracic artery give perfusion to the structures of the upper limb, right? The next branch from the second part is the lateral thoracic artery or the long thoracic artery. You can see it here. Lateral thoracic artery or long thoracic artery. Lateral thoracic artery or long thoracic artery. This remains our coracoid process. Coracoid process. The lateral thoracic artery can be called the long thoracic artery. It is the artery that arises from the second part of the axillary artery. This artery emerges and runs along the inferior border of the pectoralis minor muscle. It emerges and runs along the inferior border of the what? Pectoralis minor muscle, where it gives us a branch which supplies the pectoralis minor muscle, the pectoralis major muscle, and the serratus anterior muscle. Right? That means it gives perfusion to majorly three musculatures: the pectoralis minor muscle, the pectoralis major muscle, and the serratus anterior muscle. In female, pay attention, in female, the lateral thoracic artery is usually large compared in male, because in female, the lateral thoracic artery gives an important supply or provide important perfusion to the mammary gland through its lateral mammary branch. Through its what? Lateral mammary branch. That is why it has to be large, in order to provide strong perfusion to the mammary gland, which is the breast, right? So in female, the lateral thoracic artery is usually large because it gives an important perfusion to the mammary gland through their lateral mammary branch, right? Okay, that is all about the branches from the second part. Let's go to the branches from the third part. The branches from the third part, the first one we shall be discussing is the largest branch of the axillary artery, called the subscapular artery. Look at it here. Subscapular. The subscapular artery is the largest branch of the axillary artery. It is the largest branch of the axillary artery. How does it run? It runs along the lower border of the subscapularis muscle and ends near the inferior angle of the scapula, where it gives us a large branch called the circumflex scapular artery. Look at the circumflex scapular artery here. Circumflex scapular artery. The circumflex scapular artery that was given off when the subscapular artery ends near the inferior angle of the scapula is the largest, is a large branch of the subscapular artery, right? So once it is being given off, the circumflex scapular artery has to pass through the upper triangular intermuscular space and went around the lateral border of the scapula, where it enters the infraspinous fossa of the scapula, and thereby giving off small branches that supplies to those regions, right? That is how it runs, because once it is being given off by the subscapular artery, it passes through the upper triangular intermuscular space and went around the lateral border of the scapula, where it enters the infraspinous fossa to give little branches or small branches that also supplies to those regions. So that is how it works. The next one we shall be discussing is the second branch that arises from the third part of the axillary artery. We have the anterior circumflex humeral artery. Anterior circumflex humeral artery is a very small branch of artery that arises from the third part of the axillary artery. This artery passes in front of the surgical neck of the humerus, where it anastomoses with the posterior circumflex humeral artery to form an arterial circle behind or around the surgical neck of the humerus. Look at the arterial circle here, because it anastomoses with the posterior circumflex humeral artery to form this arterial circle. behind or around the surgical neck of the humerus. The anterior circumflex humeral artery gives us a branch called an ascending branch, which runs upward along the intertubercular circles of the humerus to supply to the head of the humerus and the shoulder joint. So it gives us an ascending branch which runs along the surgical neck and along the basipital groove of the humerus, because once it gives off that ascending branch, it descends upward, right? It ascends upward, not descends. It ascends upward along the basipital groove of the humerus, right, to supply to the head of the humerus and also the shoulder joint. So that is how it works. The next branch from the third part is the posterior circumflex humeral artery. Look at it here. The posterior circumflex humeral artery is actually larger than the anterior circumflex humeral artery. It passes posteriorly to the surgical neck of the humerus, where it anastomoses with the anterior circumflex humeral artery to still form this arterial circle. So that is how they work. So we have discussed the parts of the axillary artery, discussing its branches as well, because this forms the branches, the sixth branch, right? So the next outline is the termination. But you have to understand that, right? Along the course of the axillary artery, right? Still on the course, please, still on the course. Once the pectoralis minor muscle tends to cross it superficially to divide it into three parts, right? It also descends downward. On reaching at the level of the inferior border or the lower border of the teres major muscle, it terminates by becoming the brachial artery, right? So here, this is the teres major muscle. This is the inferior border. Border of teres major, right? This is brachial artery. So the inferior border or the lower border of teres major muscle is a landmark. It's an important landmark because it indicates the termination of the axillary artery and the origin of the brachial artery. Likewise, the outer border of the first strip is a landmark because it indicates the termination of the subclavian artery and the origin of the axillary artery. Here are all axillary artery. Here is brachial artery. Here is subclavian artery. So what is the termination? The termination is that it terminates at the level of the inferior border or the lower border of the teres major muscle. That is the termination. The branches. We have disclosed the branches of the axillary artery, the 6 branches. We use the mnemonic, which is sula thoraco pars. You can see it here. Sula thoraco pars. It has 6 branches. First branch is 1. Second branch has 2 branches. The second part has 2 branches. The third part has 3 branches, making it 6 branches of the axillary artery, right? You can list it down, right? So the next one is the relation. What are the relation of the axillary artery? The axillary artery has a simple relation, right? The first is that the axillary vein courses medially, or axillary vein is related medially along the course of axillary artery in the axilla. That means How the axillary artery runs in the axillary vein usually lie medially to it and the cause of the brachial plexus. But the cause of the brachial plexus are majorly related to the second part of the axillary artery through their cause. The posterior cord usually lies behind the second part of the axillary artery, while the medial cord lies medially to it and the lateral cord lies laterally to it. However, as the axillary artery courses in the axilla, the axillary vein lies medially to it and the cause of the brachial plexus. That is the relation. The cause of the brachial plexus on precision lies towards the second part of the axillary artery through its cord. The posterior cord usually lies behind it. The medial cord lies medially to it, while the lateral cord lies laterally to it, which is the second part of the axillary artery. So that is how the relation is. Important to note, the axillary vein is so essential because it lies medially along the course of the axillary artery in the axilla. The next is clinical relevance. Clinical relevance. Number one is ischemia. Yeah. Ischemic condition of the upper limb could be implicated when there is an obstruction of perfusion to the upper limb structures as a result of damage to the axillary artery, or lesion to the axillary artery will lead to what ischemic condition of the upper limb tissues. Right? Ischemia means low perfusion or hypoperfusion of blood to a structure. Number two is necrosis. Necrosis could be implicated when there is a total lesion of the axillary artery, which will lead to no blood supply, which is necrosis to the upper limb structure. That means there will be ischemic necrosis or necrotic condition of the upper limb structures when there is a total blockage or rupture of the axillary artery, either by a traumatic injury or a certain pathology. Number three, we have thrombolism. Thrombolism could be implicated in axillary artery whereby there is a formation of intravascular blood clot, right, at the blood vessel wall, which is the axillary artery. It will lead to hypoperfusion to structures around the upper limb. And those vascular blood clots are called thrombus. Intravascular blood clot, they are called what? Thrombus. Number four, we have embolism. Embolism could be implicated whereby those intravascular blood clot, which is embolus, will dislodge from its initial site to a new site. That is automatically what we call embolism. Already, once you dislodge from that initial site to another site, it becomes embolus, right? So it is embolus. Number five, we have collateral supply. Axillary artery ensures hyperperfusion or good perfusion of blood to the upper limb structure. That is giving collateral supply, sufficient blood supply to the upper limb structures, right? Because it has branches. These are the branches of the axillary artery, giving good perfusion to the upper limb structures or good supply to the upper limb structures. So that is what we call collateral supply, ensuring adequate blood supply to the upper limb structures, right? We have aneurysm. Aneurysm is a vascular condition whereby there is an abnormal dilation of the blood vessel wall. It could be as a result of what? High blood pressure exerted at the blood vessel wall, leading to its abnormal dilation. So it could be implicated in the axillary artery. So these are the clinical condition that is associated with the axillary artery. We have discussed this beautiful artery ranging from its introduction to the clinical relevance. I believe you enjoyed the class so much. Thank you so much for staying to the end of this class. Remember that A1 material is the best. Thank you so much.